What's the fastest method to lower blood pressure quickly without medication? When a senior brings this up, I always give the same response. High blood pressure after 60 is rarely just a result of getting older. It's driven by tension, breathing patterns, and the way the nervous system is firing. And if you never learn how to shift those internal signals, no medication or diet will create lasting calm, no matter how advanced it may be. So, in today's episode of the Senior Health Podcast, Japan's oldest doctor will walk you through 6 fast-acting tricks that bring blood pressure down instantly, and some of them only take 60 seconds to execute. You'll learn how to use these 6 tricks easily at home without even leaving your chair. Each trick is supported by both American and Japanese research and is used in settings ranging from longevity clinics to emergency care. Doctor, welcome back. I know many listeners have been waiting for this conversation. Thank you, John. This episode is especially important for people over 60. Worldwide, more than 1 billion adults are living with high blood pressure, and many aren't suffering because they're truly ill, but because they've never been shown how to regulate blood pressure from the inside out. We've taught people how to monitor their numbers, but not how to influence them. Exactly. We're often told blood pressure is simply good or bad, but it's a living, responsive system, something we can learn to guide in real time. You couldn't say that better. Blood pressure isn't only about the heart. It reflects stress levels, posture, oxygen intake, hydration, and even how we breathe. And most of those factors are within our influence once we understand the signals. That makes sense. In a previous episode, we talked about 3 breathing techniques that can help lower blood pressure quickly. But for many seniors, changing how they breathe can feel uncomfortable. So today is different. We're focusing on just simple things you can do immediately without effort or strain. And I promise for those who actually practice all 6 techniques this week, not just listen, but truly try them, you may notice more than a change in numbers. You might feel it in your breathing, your mental clarity, even the way your body carries itself. That's what I love most. Many people believe lowering blood pressure takes months, but sometimes it only takes a minute and a bit of awareness. It always comes back to awareness. And in the next few moments, we're starting with an area that almost no one talks about, the side of the neck where a small pulse point can trigger one of the fastest blood pressure responses in the body. I tried this myself, and honestly, I didn't expect much, but the first time I felt that sudden wave of calm, I knew it wasn't imagined. It was real, physical, and it happened quickly. These techniques are incredibly valuable, John. I truly hope everyone stays with us until the end, because each part builds on the last and becomes more powerful as we go. In the end, people who finish the episode will definitely have a clear roadmap on not only what to do, but also why it works. And before we start, please leave a comment if this topic is important to you. Just commenting one is enough. It helps us reach more people just like yourself. I'm genuinely excited about this episode. Me too, Doctor. So, let's begin. What's the very first technique people should know, and why does it work so quickly? The first technique is something very few people are ever taught, even though it's built into the body like a hidden safety system. It's called the choroidal sinus reflex. This reflex sits just beneath the skin on the side of the neck, right where the pulse is strongest. When it's gently activated, it sends a signal to the brain that blood pressure is too high. The brain responds almost immediately by slowing the heart rate and relaxing the blood vessels. This response can begin within seconds, but it must be done correctly or not at all. That's fascinating. I've heard of carotid massage being used in emergency situations, but never as something people could use on a daily basis. So, you're saying this isn't only reactive, it can also be used proactively. And is this something you recommend to your older patients? Yes, but always with care. I never advise anyone to press hard or rub aggressively. This is a sensitive area. What I recommend is placing 2 fingers just beside the Adam's apple, gently locating the pulse. Apply a very light circular pressure outward and hold it for 5 to 10 seconds. Then release. You can do this on one side only or alternate sides, but never both at the same time. One gentle activation is usually enough. If needed, it can be repeated once more after a short pause. Right. Sounds very doable. It is. And what this activates are bar receptors in the carotid sinus. These are tiny sensors that measure pressure inside the arteries. When they detect pressure that's too high, they send an immediate message to the brainstem to slow things down. It sounds like you're giving the nervous system a gentle nudge rather than forcing a response. Exactly. It's not forceful. It's more like a suggestion and the body listens. And what about people who deal with high blood pressure often or who notice their numbers spike when they're at the doctor's office? That's an excellent question. Many people experience what we call white coat syndrome, where blood pressure rises simply from being in a medical environment. This technique can help calm that reaction, especially when done seated and relaxed just before a measurement. So for those listening, this isn't a cure, it's a calming cue. And sometimes that's exactly what the body needs. Now, doctor, what's the second technique you find most effective? The second technique is called the Valsalva maneuver. It may sound technical, but it's actually something your body already knows how to do. It's similar to the natural pressure you create when you blow your nose or gently bear down during a sneeze. By creating brief controlled internal pressure, we temporarily change how blood moves through the chest and heart. When that pressure is released, it can trigger a short-term drop in heart rate and blood pressure. So, this one is less about touch and more about breath and internal pressure. Exactly. You take a deep breath in, pinch it, your nose closed, and then gently try to breathe out against that closed airway. It should feel like a mild push, not strain, with no air escaping. Hold that pressure for about 5 seconds. Then, fully release and breathe normally again. One round is often enough. If needed, it can be repeated once more after resting for 20 to 30 seconds. It's remarkable how something so simple, something we've all done instinctively, can create such a noticeable shift. It really highlights how often we underestimate breath as a physical tool. We usually talk about breathing for relaxation, but not enough for heart and circulation support. That's very true. Breathing influences the vagus nerve, the diaphragm, and even the way the heart fills and empties. When we create pressure inside the chest, the body briefly responds with a rise in pressure. But once that pressure is released, the nervous system compensates by slowing everything down. That's why many people feel calmer almost immediately afterward. This is also why paramedics sometimes use this maneuver when someone's heart rate is racing, right? I was just going to ask that. But it must be done carefully. Never hold it too long and never push forcefully. Anyone with known heart conditions should speak with a doctor before trying it. For most people, when done gently and briefly, it's a safe and fast way to activate the body's natural braking system. And timing matters too. This isn't something to do while walking around or driving. Never. It should always be done seated in a calm and stable environment. That really seems to be the pattern here. Gentle techniques, short in duration but powerful in effect. We're not forcing the body to change. We're working with systems that are already built in. So, where do we go next? What's the third way to bring the nervous system back into balance? The third technique is a form of breath work known as box breathing. It was originally developed to help soldiers stay calm under extreme pressure, but it works just as well for seniors. The structure is simple and precise. You breathe in for 4 seconds, hold for 4 seconds, breathe out for 4 seconds, and then hold again for 4 seconds. One full cycle takes about 16 seconds, like tracing the 4 sides of a box. This steady rhythm helps balance oxygen and carbon dioxide, which can quickly reduce stress and bring systolic blood pressure down. And that symmetry, that steady rhythm does something to the brain as well, doesn't it? Yes. It activates the parasympathetic nervous system, the part responsible for rest, digestion, and recovery. When this system becomes a dominant, the heart rate slows, blood vessels relax, and blood pressure begins to drop. What I find striking is how universal this is. Whether someone is lying in a hospital bed or sitting at their kitchen table, this kind of breathing restores a sense of control, and that feeling alone can lower stress. Exactly. And there's a variation I often recommend. After breathing in for 4 seconds and holding for 4, instead of breathing out for 4, you snorts extend the exhale to 8 or even 12 seconds. So the pattern becomes 4 in, 4 hold, 8 or 12 out. 1 or 2 cycles like this are often enough to feel a shift. The longer exhale stimulates bare receptors and slows the heart more deeply. That makes me wonder, is that long exhale the same reason people naturally sigh or breathe out deeply when they finally feel safe or relieved? Yes, it is. That long exhale is the body's built-in signal that danger has passed. It tells the nervous system it can stand down. That's why this variation is especially helpful for people with anxiety or panic. It copies the body's natural relaxation response instead of forcing one. In one Japanese study, elderly participants who practiced extended exhale breathing twice a day saw measurable improvements in blood pressure within a week. And for people with white coat syndrome, where blood pressure rises during doctor visits, this can be especially helpful. That's something many people recognize. Feeling calm at home but spiking the moment they see a blood pressure cuff. Exactly. It gives them something practical to do while sitting in the waiting room. Breathing is easy to overlook because it's automatic. But when we slow it down, even for a minute, we see how directly it affects the heart, the mind, and the body. This isn't just a trick, it's a return to the body's natural rhythm. So, let's keep going. What's the next place we can focus to calm the system? The next technique focuses on the ears, specifically a gentle massage along the inner rim and canal. This area connects to the auricular branch of the vagus nerve, which sends signals directly to the brainstem by using slow circular pressure. Here, we can activate the parasympathetic nervous system almost immediately. This is one of the few ways we can externally access this internal calming network, and the response often begins within seconds. So it's almost like a shortcut through the skin and straight into the nervous system. Exactly. In Japanese medicine, ear acupressure has been used for centuries, often to calm the heart and steady breathing. What's new is that Western research is now confirming its effects on vagal tone and blood pressure regulation, especially when the stimulation is gentle and sustained. I've seen research describe this as a neuroanatomical shortcut because it bypasses the thinking mind entirely. It's one of those rare techniques that doesn't require effort, only awareness. Yes. And that's what makes it so accessible. You can do it anywhere. You gently rub the upper inner part of the ear near where the cartilage folds inward, using slow circles for about 60 to 90 seconds. The pressure should be light, never painful. Many people notice warmth, soft tingling, or a subtle sense of calm. That's usually a sign you're stimulating the correct area. One round is enough, but it can be repeated once more if needed. I imagine this would be especially helpful for people who feel overwhelmed, who need something they can do quietly and quickly. It is. And because it involves touch, it also activates the skin's sensory nerves. That added input further relaxes the nervous system and helps reinforce the calming signal. It's fascinating how pressure and breath seem to work together here. One influences circulation, the other resets the electrical rhythm of the body. Exactly. And when both are used together, for example, slow breathing. While massaging the ear, the effects are often stronger and longer lasting. These techniques may seem simple, but they slow us down. And in that pause, we learn not just about blood pressure, but about where we hold tension. They aren't hacks. They're reminders that the body already knows how to heal when we give it space. So, let's move on. What's another fast internal way to shift blood pressure without moving a muscle? This next technique is a mental one, but its effects on the body can be very powerful. It's called a guided body scan. The goal is to slowly move your awareness through the body, starting at the feet and moving upward to the head. As attention settles on each area, tension often begins to release on its own without effort. The physical release leads to softer blood vessels, a slower heart rate, and a gradual drop in blood pressure. So awareness comes first, and the physical response follows. Yes, most people carry tension, they don't even realize it's there. Often in the jaw, the belly, or the hands. When you bring gentle attention to those areas, it's like flipping a switch. The body recognizes that it's safe to let go. What stands out to me is that this isn't about fixing or changing anything, just noticing. There's no special breathing, no movement, just observation. Exactly. And that's what makes it accessible to everyone. You sit comfortably, close your eyes, and bring your focus to the soles of your feet for a few seconds. Then you slowly move that awareness up through the ankles, the legs, the hips, the spine, and all the way to the top of the head. The entire scan can take, clears throat, as little as 60 seconds or longer if you choose. Some people imagine a warm light or gentle mist moving with its attention. Others simply notice the feeling of gravity and contact with a chair. There's no right way to do it. It sounds deeply grounding, especially for people who live with chronic stress or anxiety. It is. And even 1 minute is enough to begin calming the nervous system. You don't need a long session for the body to respond. That's something many people need to hear more often. That rest doesn't have to take hours. Even a single minute done with intention can change how you feel. Yes. In Japan, we often teach this to caregivers and nurses during short breaks. It's a tool not only for patients, but for anyone working in a high-stress environment. That's powerful. High blood pressure is often invisible. People don't always feel it building. They just wake up one day and see higher numbers. What you're offering is a way to sense the body before the numbers change, to recognize the signals while they're still subtle. That brings us to something a bit more physical again. Please, everyone, stay with us for the final one. Let's keep this moving. What's the sixth and final technique that works almost immediately? Yes, we're almost finished, and this final technique is important. After this, I'll just have to explain how to combine these methods. The word is yours, Doc. Okay, the final technique is a warm water foot soak. It may sound almost too simple, but it's one of the fastest ways to reduce vascular resistance. When you place your feet in warm water, the heat draws blood downward away from the core. This shift in circulation reduces pressure on the heart and brain, leading to a measurable drop in blood pressure. So, just sitting quietly with your feet in warm water is enough. Yes, the water should feel comfortably hot, never scalding. About 10 to 15 minutes is sufficient. If you add Epsom salts, which we discussed recently, many people experience even deeper relaxation. That makes sense. Magnesium supports blood vessel function and muscle relaxation, so together they amplify the effect. Exactly. One study found that seniors who practiced this 5 times per week experienced lasting improvements in systolic blood pressure. The warmth widens blood vessels in the feet and legs, which lowers pressure in the upper body. That redistribution is especially helpful for people who feel tension in the chest or neck. And because it's passive, there's no strain on the heart. It's also an excellent option before bed, as it prepares the body for sleep. That's especially helpful for people with nighttime blood pressure spikes or difficulty falling asleep. Yes, and simply slowing down has benefits on its own. The warmth and stillness aren't luxuries, they're forms of medicine. What really stands out is that everything you've shared is about calming the body, not pushing it. So, for someone just starting out, how would you recommend bringing these 6 techniques into daily life? I always tell people not to try to do all 6 techniques every day. Instead, choose the 2 that feel most natural. 1 in the morning and 1 before bed. That alone is enough to begin shifting the body's patterns over time. Chint about doing more. It's about being consistent. Exactly. It's about rhythm, not quantity. Just like walking each day or brushing your teeth, it's the repetition that creates change. That's a refreshing way to look at it. People are overwhelmed with wellness advice. So, being told to slow down and simplify is rare. Yes, and that's the beauty of these methods. They bring us back to the basics: breath, touch, warmth, stillness, things everyone has access to regardless of age or background. When practiced regularly, they don't just lower blood pressure. They build trust with the body again. And that's where real healing begins. So, it's more than a routine, it's a relationship. That's right. The more we respect that relationship, the more the body responds. Amazing, Doctor. If you're still listening, please let us know in the comments so we know who is listening. Please like and subscribe. Oh, and watch this next video right now. Yes, please. We've picked this one especially for you.